Hi, I'm Skylar Kenny from Pharmacy Times, and joining me is Debra Goff, infectious disease expert at The Ohio State University Wexner Medical Center. Today, we'll be discussing C. diff, risk factors, treatment options, and why awareness of this disease is so important. What are the primary risk factors for C. diff? Who is the most at risk for contracting it?
That's a great question. When I look at risk factors, I divide them kind of into three general categories: demographics, medication, and environment. So if you look at demographics, it's basically people over 65 years of age are at higher risk. Females, which is interesting, immunocompromised patients, chronic kidney disease, HIV patients, inflammatory bowel disease. Those are pretty much the highlights in the demographic section. When you look at medication, the biggest risk factor, which is where my passion lies, are antibiotics. Any antibiotic can cause C. diff. A single dose of an antibiotic can cause C. diff. Many physicians, dentists do not know that. They think a single dose is, just too little. Any antibiotic, but there are some that are higher risk. Clindamycin is one that actually has a black box warning for C. diff, but C. diff warning is in all package inserts for any antibiotic. But C. diff is one of the highest. And then proton pump inhibitors is another class of drugs that has a high risk factor for patients developing C. diff. And then the environment. When you're in a hospital, if someone cuts a few corners in cleaning, those C. diff spores are incredibly difficult to get rid of. And you have to use very specific cleaning technique. And, who's the lowest paid person in the hospital? It's environmental services. We're not watching them when they're cleaning. So we've actually now invested in very expensive UV light, these little robots that do the cleaning and kill the spores. It's expensive, but not more expensive than having a patient die because they acquired C. diff in our hospital. So it was a really important investment that we made because we would continue to observe patients that would acquire it in the hospital setting. So the environment, but also in the outpatient setting. So don't think it's just the hospital where you can get C. diff. You can go to a doctor's office. These spores are very hardy. And so the environment is another big concern.
What benefits would there be to designating C. diff as a nationally notifiable disease?
Well, people might actually take it serious and become more aware of it. That's the problem. I speak to so many healthcare providers, and when you inform them that C. diff actually can result in the death of a patient, they're like, I've never heard of that. Well, there's the problem. When you don't have it as a publicly reported infectious disease and put the numbers out there, a dentist, if they prescribe an antibiotic, the patient isn't running to them when they have C. diff. They're running to the emergency room. They come to us. So, if an orthopedic surgeon is recommending antibiotics for a lifetime in every joint implant patient, when they go for a dental cleaning and that dentist prescribes it and C. diff results for the patient, that orthopedic surgeon is never going to know that any harm has been done to the patient by their recommendation, because it's not fed back to them. So making it publicly reported just increases awareness and holds us accountable.
What treatment options are currently available for C. diff?
We actually have quite a few, but the guidelines have changed. For decades, it was metronidazole or vancomycin orally. So when you got C. diff, those were the two choices. And then we had a newer therapy about 10 years ago come to market called fidaxomicin. Very different in terms of pricing. Metronidazole or Flagyl is about $4, and fidaxomicin is hundreds of dollars. And so there's a big difference. The new guidelines by the Infectious Disease Society of America and SHEA published this year, along with gastroenterology guidelines, we now recommend vancomycin or fidaxomicin as first-line agents. Metronidazole is not recommended.
Are there any therapies in development that you are aware of that pharmacists should know about?
Yeah, that's actually the one area of real excitement in the management of C. diff. There are so many. I just jotted them down because some of them still only have numbers, but we look at really different approaches. Instead of developing an antibiotic that impacts on C. diff spores, we're seeing some new technology like microbiota-based therapeutics, live therapeutics. Ferring Pharmaceutical Company is developing its RBX 2660, looking at that therapy. The NIH is investigating fecal transplants. That's something we can do currently, but they're investigating them in further detail. Ceres Pharmaceutical Company has a microbiome therapeutic to help decrease recurrence. Summit Pharmaceutical has an antibiotic for the treatment of CDI. Artugen has a oral product that they're looking at to prevent recurrence. Finch Therapeutics has an oral administration. Real excitement, though, is a vaccine to prevent it. I mean, treatment is great. We love having all these new approaches, but vaccine for prevention of C. diff is also in clinical trials. So that's a pretty exciting concept, and we're watching that quite carefully. And then there's also ways to try to decrease the actual acquiring of C. diff. You know, if you have to take an antibiotic, which many people do need to take antibiotics, there's been a lot of research with probiotics to help prevent it. Also in prevention of recurrence, other drugs that are already approved. Bezloteksimide is a monoclonal antibody that we use. And as I stated previously, fidaxomicin, those are the two newest ones.
I hadn't heard of a C. diff vaccine before. That's fascinating.
Yes, it's exciting. So it's still in, it's a 2-dose regimen being looked at in patients that are greater than 50. So we're hoping that that will come to market sometime soon.
I understand that you're on the Scientific Advisory Council of the Peggy Lillis Foundation, a C. diff awareness organization. How did you get involved with them, and why is awareness important, and how do you help their cause?
Yeah, so I actually came to find them on Twitter. I use Twitter to engage people globally and locally in the discussion of antimicrobial resistance and the harm from antibiotics. And Christian Lillis and I actually connected over Twitter, and he started following me. And I always research a business or an organization before I will choose to follow them. And I looked them up, and I was really incredibly impressed. And so I reached out to him, and we had a conversation. And then I actually met him when he came to Ohio State. And I really could feel his pain of loss of his mother from a very unnecessary death. And, you know, that's really what my passion is, to prevent the harm from antibiotics. Antibiotics treat and have saved the lives of millions of people, but they can also harm you. And that is a big misperception by so many healthcare providers, that they're just benign antibiotics, right? They're safe. Everybody takes them. You get a cough, you call your doctor. I need a Z-Pak. I don't have time to be sick. Even consumers just think there's no risk. And what I saw the Peggy Lillis Foundation doing is personalizing their story. My mother died because of an unnecessary antibiotic, and she was prescribed clindamycin. It may have been indicated to prescribe an antibiotic. I don't know her dental situation, but she did not have an allergy to clindamycin. And so, you know, that to me seemed unnecessary. And then the lack of awareness by the diarrhea that occurred, the significance of her symptoms, and she died. You know, it was too late. And so I think what the Peggy Lillis Foundation is doing is putting a real face to the problem. So I just loved what I saw, because I can only speak to so many people. But the Peggy Lillis Foundation are personal stories of people impacted by C. diff, which is different than a healthcare professional talking to you. These are heartfelt stories of loved ones who lost their loved one to C. diff, or they have personally had it and trying to live with C. diff. You know, people go, it's diarrhea. No, you can't go to work when you have C. diff. It's explosive diarrhea, and it's uncontrollable. And, you know, I have a dear friend who's a nurse. I mean, you can't go into a hospital when you have C. diff and work. It's been catastrophic. So I look at not only bringing awareness is what they do, they also connect with policymakers, they have the support of the CDC. And, Christian, they are fighting to get this as a publicly reported in every state and really moving it up to have more recognition so we can prevent the harm from antibiotics being given unnecessarily that potentially could result in C. diff. They also connect with our policymakers. So, they do attend the Hill at Washington, D.C. to lobby and bring awareness. And really, I call them kind of the whole package. They are all inclusive in trying to educate consumers, tell the personal stories from people who have suffered from C. diff, engaging with pharmaceutical companies who are making the C. diff therapies and the great things that they're doing to provide support to the Peggy Lillis Foundation, working with the CDC, who creates health policy for the United States, and then working with healthcare providers like myself that do antibiotic stewardship and want to provide our expertise and really our ongoing support for this advocacy to increase awareness of C. diff.
Do you have any closing thoughts today?
Well, I want to thank you for having this interview because, again, it's another avenue. I hope many healthcare providers and many pharmacists will view this because pharmacists really have a very important role in C. diff. I look at my colleagues in the retail setting. They're dispensing the antibiotics. You have an obligation. I don't think they read the little sticker labels that are put on there. Really bring it to their attention. If you develop diarrhea, do not ignore this and call and seek advice because there is a form that is very severe and has actually resulted in death. That will get people's attention. It's really how you share the information. So I think they have such an important role in increasing awareness of C. diff. It's not to scare people. It's reality. This actually could happen to you. I think that's an important component that pharmacists in the community really can help this cause. It's not just hospital pharmacists that see the patients with severe C. diff that need to be engaged. It's everyone and just all healthcare providers. I think we have such an important role in using antibiotics more responsibly. That's the whole message of antibiotic stewardship. Antibiotics save patients' lives, but they also can create great harm. And I really am proud to be part of the board at the Peggy Lillis Foundation to help continue to move this advocacy and continue to increase awareness.
Dr. Goff, thank you so much for taking the time to speak with me today.
Thank you. It was a pleasure.